And in Health Matters this morning, an alert about kidney disease. Some groups are more at risk than others, and they're actually less likely to receive a kidney donation. Joining us now with more on this, Dr. Michael Cooper from MedStar Georgetown Transplant Institute. He is the Director of Kidney and Pancreas Transplantation at MedStar Georgetown, their Transplant Institute. Thank you very much for talking with us this morning, for coming in early. So can we talk specifically about, I know that April is National Donate Life Month.
Correct.
So it's good that we're getting the word out now. And can we talk specifically about these groups that are more at risk than others?
Sure. So the challenge with kidney disease is the most common conditions which lead to kidney problems are high blood pressure and diabetes, which are unfortunately very common in the African American population, a population which we see a large number at MedStar Georgetown Transplant Institute across in D.C. And that's the biggest challenge that we face is, African Americans being the largest population who unfortunately suffer kidney disease. When we then look to potentially talk about living donations, so like I said, being a Donate Life Month, it's also the population that most of people that have kidney disease look to for potential donors, and so they're looking within their family members, and it becomes somewhat of a challenge. So it's a double-edged sword. They have the kidney disease, and they have relatives who perhaps also have kidney disease, making it challenging for them to find living donors.
Yeah, I understand that African Americans 3 times more likely to suffer from kidney disease.
And that number is probably underestimated. It may be even higher than that. That's only the numbers that we know about, but certainly we know the risk of high blood pressure and diabetes is at least 4 to 5 times higher than most other demographics.
Okay, now you've got some tools here. I understand you're going to talk to me about a procedure that can get folks home faster if they have a transplant.
Correct. So what has revolutionized transplant is the way in which we're able to perform the donor procedures. It's called laparoscopic surgery. It has all these interesting names, minimally invasive. What it really allows us to do is, rather than to make an incision to take out the kidney from the donor, which is a painful incision for most people, we do everything through minimally invasive techniques.
So what do we have here?
And so instead of actually making incisions, we use things called trocars, which allow us to get access in the abdominal cavity, and they come in different sizes. One of which we use to put a camera in. It allows us to operate very like we're looking at these cameras today. And then with those trocars in place, we're able to use instruments that act as extensions to the surgeon's hands and able to do things rather than having to put our hands inside the abdomen. We then are able to use special devices to actually secure control of the vessels, the artery and the vein to the kidney that you see in our picture here.
Okay.
At the end of the procedure, we have even special instruments that allow us, again, rather than having to operate and put our hands in there, we have a bag that the kidney can drop into.
Wow.
We then pull that kidney out through a very small incision. The incision really only needs to be as big as the fist, because that's really the size of the kidney.
Okay.
But it's a much better operation for our donor. It takes about 2.5 hours. Average stay in the hospital after a procedure like this is about 2 days rather than our old technique, which was sometimes up to a week and much more painful for donors.
And then after they go home, how long are we talking about for recovery?
Really, the only physical limitation is no heavy lifting for about 2 weeks. Even though we have incisions that are closed, we don't want people to work too hard that can develop a hernia at their incisions. But most people are back to doing everything they were doing before the donation in about that 2-week time period.
And so maybe for this African American community, are there specific symptoms that they should be looking out for to know whether or not they might have kidney disease?
Well, the kidneys are amazing. They do so many things, but they don't give us indications that there's anything out of the ordinary. And so some of the early signs, sometimes people start to see what we call a foamy urine when they're going to the bathroom.
Okay.
Sometimes people start to feel lots of fatigue for no good reason. They start to develop edema, particularly in the lower extremities. The reality is the best thing to prevent kidney disease is to identify it early. So going to a primary care doctor to find out things like what your blood pressure is doing, to make sure there's no signs of diabetes, and particularly for those that have a family history of such, getting to your doctor early is the most critical way to take care of kidney disease.
Good advice. Dr. Michael Cooper with MedStar Georgetown Transplant Institute. Thanks for coming in and for showing us all of your neat tools.
No, we appreciate you having us, particularly for Donate Life Month.
Right.
Anybody that has information, please call MedStar Georgetown Transplant Institute. We'd love the opportunity to help.
Great. All right. You guys are doing great work. Thank you very much. All right, Larry?